I'd like to introduce to you Anthony Everidge. He's the Director of Respiratory at Pima Medical Institute here in Las Vegas. He's been the director there since 2008. And prior to that, he was Manager of Respiratory Program at Community Hospital. Is that in Las Vegas as well?
Actually, upstate New York, Glens Falls.
Oh, Glens Falls, I know it well. And he has a bachelor's degree from SUNY Albany, New York. SUNY is the program that gave me my MD, so I'm happy to see an alumnus. That's exactly right. So without further ado, Anthony's going to be speaking to us about the importance of pulmonary rehabilitation.
No, actually, I'm going to just talk and we're going to hand out some information. So, thank you. Good morning. How is everybody today? Good morning. All right. Pleasure to be here. It's been a busy week for us as respiratory therapists in the state of Nevada and Las Vegas. We just had our International Congress, and I serve as a delegate for the AARC here in the state of Nevada also. So one good bit of information that I did learn and like to pass on too is that pulmonary rehabilitation is actually going to about double reimbursement in the year 2015 coming up. So that's good news. As far as reimbursement, that's always been a sticking point for a lot of different institutions. So that is definitely good news coming down the line. You're going to be getting some information. This is Miss Amy. She's the Clinical Director of Education at Pima Medical Institute. Also, she's helping me hand out some of the information. There's a lot of information that I could cover. Obviously, I could speak for quite a long time. Some say just because, but I would say based on the information, I typically could speak for a while. So what I'm doing is I'm handing out this information so that you have it in front of you. What this is not going to be is me coming up here and saying to you, pulmonary rehab is important. Obviously, you know that, right? Who's familiar or been through pulmonary rehab? All right, so we know it's important. And I know that you know it's important. And typically, when I speak to my audience, I do exactly that. I speak to my audience. Most of you are probably very well versed in the process, the disease process that you or a loved one is experiencing. So what I don't want to do is come in here and say, exercise is important. We know that, right? Well, I think what I want to do to you, and I know the time is short, and that's why I've passed out some of these. I'll refer back and forth to the information. What I want to do is I want to be able to talk to you about pulmonary rehab from the perspective of those who maybe aren't completely familiar with the whole total package. I was responsible back in New York some years ago for designing the pulmonary rehab program at the hospital that I was at. It is still a 460 bed community hospital between Plattsburgh and Albany. So we had a very large area that we served in a very large community. And the pulmonary rehab program was pretty big, and once we got it running. So I'll talk a little bit about that. The information that you have in front of you I may refer to. There's some stuff on health and diet, which is also very important. But what I would like to do is in the last 15 or 20 minutes, and again, because of the audience that you are, is I'd like to get a little bit scientific with you like I do with my students, if that's okay with you. Good? Okay. And so I have props that I brought to help it be more basic, but it will be somewhat scientific because like myself, being a scientist and an educator and you wanting to learn, you probably, if somebody tells you something, hey, go exercise because pulmonary rehab is good, all right, you agree, but why is it good? Why? How is it helping you specifically? And so hopefully I can give you some of that information so that when you are in the process of your pulmonary rehab or taking some of the talents that you've learned in pulmonary rehab to your home, to be able to continue to do those exercises and to really visualize what's going on anatomically and physiologically in your body. So that is what I'll try to do in the next 20-some minutes. And then we'll have questions and whatnot at the end. All right. This, I told you that there was some new news coming across the wires. I literally got this morning in my email, and it was in the AARC. It was from the American Thoracic Society, and it's new guidelines for pulmonary rehab. So I'm sure you'll be seeing these coming across your wire too. By definition, pulmonary rehab is a comprehensive intervention based on a thorough patient assessment followed by patient-tailored therapies that include, but are not limited to, exercise training, education, behavior change designed to improve the physical and physiologic condition of people with chronic respiratory disease and to promote the long-term adherence to health-enhancing behaviors. Absolutely. And that is why you would go to those pulmonary rehab programs. You are going to see in the handouts that we gave you, there's actual exercises, because this talks about also the exercises, the interval training, strength training, upper limb training, transcutaneous neuromuscular electro units, or TENS units, that can also help too. Now, obviously, too, here we have people that are in, you guys are in different stages. Some people are in certain stages that are more advanced, some less advanced. So the important thing to remember, too, about pulmonary rehab, and the scientific studies prove that regardless of where you are in that process, that these pulmonary rehabs are going to give you activities and behavioral changes that will improve your symptoms, give you better exercise tolerance, and basically improve the quality of life. That's true, and that's why pulmonary rehab is important. And so this goes through a list of all of the things that kind of, if you ask me, are sort of like Captain Obvious. That is why you do it, right? And so again, we understand that, you understand that, but why is it specifically that you want to do these things? Well, you want to be able to manage your illness. You want to be able to control your illness the best that you possibly can. And so by going through these routines and by going through these machinations of exercise, you can certainly do that and have a better handle on the symptoms that you may have to be dealing with at the present time or down the road. So pulmonary rehab is not really just all go there and exercise. All right? If you could exercise your way out of it, I'm sure everybody would, correct? But we know that that is not the case. Exercise is certainly a component to it. One of the handouts that I gave you should have, well, components of pulmonary rehabilitation program. Everybody has that one? Okay. And so what it does is it shows you. It talks about the education. Education. This is an education day, and that's why you're here, correct? So education, when I implemented the program back in the state of New York, was a very large component. We had an educational process every week where we would have a lecture during the time for pulmonary rehab. And the education would extend from all of the things that you see in front of you, some physiotherapy, anatomy, movement, muscle training, lower extremity muscles, upper extremity muscles, respiratory muscles, psychosocial support, nutritional support, and occupational therapy. In the program that we had an occupational therapist, we had a respiratory therapist, a physical therapist, a cardiac nurse, and we had a fairly extensive interdisciplinary team that worked in pulmonary rehab. You are going to see that flourish in the days coming. Obviously, we all know that the nature and the environment of healthcare and insurances has changed dramatically and still evolving, but education is the top on there now because educating disease process is really the best way to have control over it. So you can see also on the next page of that is a diagram that shows you basically all of the things that I talked about. The pulmonary rehab is the center, and then all of the outshoots from that would be part of that pulmonary rehab. Breathing management. I would say that breathing management is a crucial reason why you would attend pulmonary rehab. Controlling your breathing, controlling the feelings of breathlessness, controlling that dyspneic reaction. Having that more in control so that, one, theoretically it could happen less, or two, you could shorten those exacerbations. Am I correct? That would be a big part, and that was always a large part of the patients that I dealt with in the pulmonary rehab where I was. All of those other things are definitely part of it. You can't do all of the whole in the center without including all the different facets. But let's face it, if you can't breathe, you're not really thinking about a whole lot of other things, right? I will tell you, and I probably should have told you in the beginning, I have been involved as a respiratory therapist for 32 years. So I know you're thinking, how are you so young? Is that what you're thinking? I thought so. Yeah, I read your mind. Yeah, it's true. So some 30 years. And I found the key is that when you can't breathe, that's all you can think about. And really, that's it. And so a lot of times when I have my students come in and I say that to them, they're all fairly young and healthy, and you say it, but they don't really get it. And I say, okay, so now hold your breath. And I literally make them hold their breath for as long as they can so that they have this feeling of breathlessness. And usually it's about 12 or 15 seconds and somebody busts out, but it just kind of zeroes them in on a reality. And so I also have them breathe through their hands with a covered mouth so that I interrupt flow and it doesn't feel the same as getting a good breath, which is a sensation that I'm sure that you may be familiar with, so that they can feel that and actually understand, hey, for that second or 2 or 3 or 4 seconds, that is all they were thinking about. And so think about that, but on a lot of your breaths, breath after breath. And that's what you'll have to understand that your patients are feeling. So it puts them in the moment, and it really makes them realize, hey, this is very uncomfortable, and it's not conducive to a lot of happiness. So whatever I can do with that pulmonary rehab team to reverse that process at the present moment or to make it better. We know I can't completely reverse it, but to make it better for those moments and to make it better in the future and to have techniques where I can elicit those techniques in order to make that sensation go away or be better or control it from happening as much in the future is what I believe to be key, and you probably would agree. So also, on the handouts, I've given you probably something that you've seen and heard a zillion times. Pursed lip breathing, diaphragmatic breathing, right? Everybody is familiar with the techniques. I gave you the instructions and directions because this is what we typically do in rehab. And so I'm sure by show of hands, who applies those techniques? All right, and so the techniques, how's your success? Good, bad, otherwise? Is it good? Raise your hand, good, right? Sometimes it's difficult to do though when you can't breathe real well, right? And somebody will tell you, well, you have to use your techniques and you have to use your pursed lip breathing. But when you can't breathe, and I see you nodding your head, when you can't breathe, it's really hard to say, okay, I have to breathe through my nose and I have to exhale much slowly, when all your body is saying is, hey, I don't really know what you're thinking or what you're doing, but get me some air, right? And so you want to gulp and you want to suck air at a large rate. And that's not really the best way to do it. So when we're doing and applying these techniques, they certainly do work because they apply a certain physics to anatomy and physiology. Well, here's the part where I have somebody who's my timer too. Good time-wise? All right, I don't want to go too far over because we have questions at the end. And so here's where the science application comes in, right? And here's where some of the scientific part that I would teach my students that we're going to talk about, because who better to know the science of what's happening than you here, all right? So, science-wise, there are 4 basic functions of life. 4 basic functions. The very first one being ventilation. All right? I must take air in and I must get air out. And when I say ventilation, air in, air out, that is the good air, if you will, and that's the oxygenated air. And then I want to get rid of that CO2, right? Because that's all our body really wants to do, is take in oxygen and get rid of CO2. And that's usually where I tell my students, if you don't believe me, now let's hold our breath. And after a certain amount of time, they can't do anything but exhale because it has to come out. So I must ventilate. I have to do that, all right? I must oxygenate. I must derive that oxygen from the atmosphere that I'm trying to pull this breath in from. Have to ventilate, have to oxygenate. I must then circulate that blood around in the oxygenated blood in order to do the fourth one, which is perfuse. So I then must perfuse my tissues and my cells, because that's the whole reason why I'm taking in that ventilation. My body needs that oxygen, it's the gas, in order to keep our cells going. The only way that I can do number one, that very first important ventilation, the only way that I can do it, and probably somebody was sitting here thinking about this earlier, is through something that we call pressure gradients. Have you heard of pressure gradients? Well, pressure gradients just tells us that these first laws of motion and dynamics is that a gas only can move when it goes from a higher pressure to a lower pressure. All right? That's logical, that's physics, that's the way that we all do it. You don't think about it a whole lot. Herein where the problem starts to lie. When we create this gradient, we do it by the muscular activity that's created when we make that inspiratory movement. So when you make that inspiratory movement, certain physiologic things happen. Your diaphragm is going to contract, your intercostal muscles are doing things which are going to allow your chest cage to expand and literally pull it down, if you will, and cause, and we'll keep it simple, and cause what kind of is like a sucking type motion. And so if you put your head around that, well, okay, so we're sucking in this gas that's around us, and that pulls in your ventilation. So I have to have these muscles. The inspiratory effort is a muscular movement. Now on the other side of the inspiration is that expiration. That is a passive recoil from the energy stored in our lungs from the inspiration. All right, I did promise it was going to get a little scientific, right? But that's all right. You don't really think about it. You exhale because our lungs are made of, you've probably heard of the alveolus, right? The alveolar sacs. And that's where all the action takes place. That's where all that diffusion and transference between oxygen, the air, and the CO2 takes place. And so we have, as a grown adult people, we have approximately 500, 600 million, depends who you read. I'm not really sure who counted anyway. And then when he was counting, was he like 490 million, 990, and somebody says, hey Bob, did you get, oh dear, is exactly what he said. Oh, 1, 2, 3. It took him a long time to count those. So, but we have approximately many, many, many. And if you've ever heard any information, there's two kinds of airways in our body. One, which is like PVC pipe, I like to tell my students, they conduct air. The others, which have more of a transmission ability, if you will. That's where the gas can then exchange and go to feed your body with the blood. And so in our body, we have these two different airways. If we ruin those, or if some disease process, if you picture them like a bundle of grapes, anybody ever tell you that part? If you picture them like a bundle of grapes, and so you have this top of the grape bundle, which is an airway that leads into all of these grapes, and we have the blood that's swirling around them. And so this diffusion process happens across those grapes, if you will. And so those grapes are very delicate. Your alveolus are very, very delicate. If they are ruined or interrupted by a certain disease process, it's not like a chameleon's tail or a salamander's tail. It's not going to grow back. And so the problem is when they get disturbed or ruined through a process, which the process for alpha is that there is a process that does cause problems in there. And it bothers the integrity. Now remember I told you we want to breathe in and we expand those alveolus. And then by natural recoil, because they're very elastic, all right? They're like a rubber band, elasticity. They have that property. And so when I stretch a rubber band, what does it want to do? It wants to come back to what it was. And that's very important. And so what happens is in the process is that these alveolus, or the grapes if you will, get stretched out. And so when they get stretched out, they then lose that elastic ability or recoil to exhale back out. And so the bad gas that we talked about in ventilation winds up being trapped in those alveolus, or if you will. I always bring props into my classroom, and these are actually the original props. And so I use balloons to show the alveolus and the recoil properties. And so if this is a nice alveolus, you can see that it's an original balloon, and it's in its original shape. If I blow it up, it would go back. Say stand back and kiss it. It would then empty out to its original shape. And so it starts that way, it expands out nicely, and then it comes back to its original shape, which is good because it gets rid of the bad air. This, you can see, balloon is a bit over distended, right? It looks like it's been around a while. If you can see from the back, I don't know how well, but it's stretched out. And so therefore, it has lost that elastic coil property to come back to the original. Our lungs have a finite amount of space, which means I take in a certain amount of volume, and everybody's here is a little different, and I release a certain amount of volume. If I can't release it because I've lost this property and this is all stretched out, guess where it stays? In here. And if I have that's the bad gas that we want to expel. If I have a finite amount of space to release this and I can't, well, guess what? I have to take my next breath with this half filled with bad gas. You can see that doesn't even look right, right? Okay. Well, that makes filling this up with the amount that we need to our tidal volume much more difficult. I have to now work harder. My work of breathing becomes harder to fill the volume I need on top of this bad gas that's left in there. Is everybody following my balloon logic? Okay. So that takes us back now to some of the importance of the pulmonary rehab. In pulmonary rehab, you learn pursed lip breathing. You learn diaphragmatic breathing. What they probably don't tell you right away in pulmonary rehab is that your chest is, I told you already, inspiratory maneuver requires muscular activity. So our lungs always want to recoil from their stretch. That's their thing. They always want to get back to being in original shape. Our thorax, this rib cage that we have around us, always wants to be expanding out. It wants to be like making that boing noise. And so if we didn't have those muscles holding it, that's what it would do. And so we have this relationship between the thorax and the chest, of which you probably never really think of, which is always constantly working against each other, but working perfectly together. Because when I expand and I take a breath in, it's great because my thorax expands out and it lets that pressure, that negative pressure, and it pulls in my volume. Well, then guess what? Your healthy adult lungs then recoil back and literally pull that thorax back in, squeezing out that bad gas. And that's theoretically how we take a nice normal breath. In the process of the disease that we're talking about today, all right, most of the studies show that, especially when we get more advanced, that we don't have the same style tissue, right? We lose that nice dense lung tissue, and we have more of that air trapping quality and more of that bad gas left in, so that when you exhale, it's left with that volume. So when you go to a pulmonary rehab, they're going to teach you how to have better FRCs, which are those residual capacities that should be left in your lungs afterwards. Because if I still have this volume in here, and I can't, I have to struggle, I have to work harder in order to get my next normal volume in. When we talk in the context of working harder, and I already told you earlier in the beginning of the presentation, that we require oxygen as the gas, correct? And so if my body is required to work harder, what do you think is going to require more of? Oxygen, right? Well, if I can't get it from the beginning of my breath because I'm not taking an adequate volume, then your body says, hey, just like I said in the beginning, I need more volume, more gas. And so when you become short of breath, and when you get into an issue which a pulmonary rehab teaches you how to control better, when you become short of breath, and probably you'll recognize this, it usually gets you caught up in called that spiral of dyspnea, right? And you probably know what I'm saying. You start off and say, uh-oh, here we go. And so that spiral, you get short of breath, and then you're working harder, and then you're breathing harder, and then anxiety comes into play, and the next thing you know, that your wind is just out of your sails. Does anybody understand that sensation that I'm talking about? And so what pulmonary rehab does is it does all of the things that we outlined, and it does all of those big things, and it takes into consideration where you're at in the disease process. It takes into consideration some other things we'll talk about briefly about nutrition and whatnot. But what it does is it physically teaches you how to say, okay, hey, I'm in a situation where I don't have my anatomy and physiology working perfectly in a symbiotic relationship. It's trying, and it's trying very hard. So what I need to do is I need to understand the process of what's going on. When you become short of breath, you have, and again, you know this, you have something that is termed as obstructive disorder, right? Everybody's heard the term? All right? And so obstructive disorder, sometimes people, I know that sometimes I've had patients who come in and they've heard the terms and they know the terminology, but they really, well, what does that mean? That means they can't get a breath in. Well, actually, no. The obstructive disorder means you can't get that breath out. And that's where the problem comes in, because your lungs are designed to go back to their normal recoil, to empty out and allow that next good bunch of air to come through. So when you go to and you talk about your obstructive disorder, it's because you have that air trapped in there. So when you come to pulmonary rehab, I would always try to explain that. We would try to make it as simple as possible and then give you exercises that can actually help you with those, and to educate you in the process of, hey, I'm feeling short of breath. I can't get that breath in. Here's what I need to do. I would say probably that pursed lip breathing is probably one of the biggest and first things that you ever talked about or learned to do. Did you learn that early? Who learned that early in the process? Pursed lip breathing. Okay? And so pursed lip breathing, you're probably told, is going to help you catch your breath, right? Well, let me give you a little bit of the science behind it. If you already know it already, that's excellent. If not, let me give you some of the science behind it and how it helps. Because I would tell my patients, here's what you need to picture yourself as a lung. You need to picture yourself as that alveolus. You need to put yourself in a situation in order to catch your breath and really understand. And it helps. It definitely helps you control. To physically visualize what your anatomy and physiology is like. So when somebody tells you to pursed lip breathe, they would tell you to breathe through your nose, right? And then they were going to tell you to exhale through pursed lips like you're breathing. You may have heard blow out a candle, smell flower, blow a candle type of thing, right? And so what it does is this, and I'll give you the science of it. Again, I'm getting a little bit of my time factor coming at me, but I want you to know this, because this is what I would give to my patients and have given to my patients, because it truly helps. If you can educate yourself and know the science of it, you can certainly master it better. So when you're doing that pursed lip breathing, here's what's really happening. Here's what you're trying to create. Remember I told you that that gas was trapped in the lung, in those airways. And that an obstructive disorder, one of which alpha is, causes those airways on the outside to collapse. So when you take in this slow breath that they tell you to breathe slowly, right? Oh, it's always slow down. Hard to do when you're out of breath. But the reason for that is when you slow down and take breath in, fast-moving gas is really erratic and turbulent, and it doesn't flow as nicely as slow-moving gas. So when you breathe in with those pursed lips, with the pursed lip method, and you breathe in through your nose, you're forcing it to be a little bit slower down in these lower airways, and therefore distribute better. And so you breathe in, you breathe this volume in. On the exhalation part with the pursed lips, what you are doing is creating, and you may have heard this term, a back pressure. All right, anybody have heard that one before? If not, what you are doing is creating, now you have, a back pressure. And what that back pressure does is it does not allow that gas to just come out and change all of those intrapulmonary pressures, which we won't get into, and allow that airway to collapse down. By breathing out slowly and telling you to count the number out to 6, you are not letting that air come out as quickly, and you are stenting open your own airway. So we're keeping the pressure behind our lips and holding, if you will, the neck of this balloon open a little bit longer. So if I go slower, it will empty out better, all right? So that back pressure with pursed lips is creating a back pressure to stent open your obstructed airway, which is the airway that will fall down, and keep that bad gas trapped into your lungs. And so the theory is that if you can get rid of that bad gas, well then guess what it's going to leave more room for on the next breath? The good gas. And if I empty out that alveolus, which is now not overstretched, right? If you pictured that balloon full, half full, and then me trying to blow it up with the same volume that I would when it was empty, I'm going to have to push a lot harder, correct? Well, the same thing with this balloon in your alveolus. If you can empty it out, you are not going to have to work as hard to fill it up with good volume around the bad volume that's already trapped. And so if you can picture this, and I would tell my patients, picture your lungs. Picture them in your mind a little bit overinflated. Hyperinflation is a big problem. Picture that when you are physically doing the motion of the expiration in your pursed lip. And picture that and feel your lung emptying. This is what you're going to learn a lot of. It's one of the very first things that you learn, either bedside in a hospital, or your therapist will tell you, but it's a big player in the world of pulmonary rehab. But if you picture that and you empty out those lungs, again, it's going to help you then take that next breath. By the exercises that are listed in here, all of the things that you may do as far as lower and upper strength, it adds to the muscular strength of the intercostals and just in general, making the motion of inspiration easier for you if your muscles are stronger. And so that's why they have you physically doing that exercise. It's not the exercise per se that's making you breathe better. It is understanding that the call and the need for the oxygen by strengthening those muscles, but understanding the physiology of what's actually happening in your lungs. And that's where the key comes, you as a patient in a pulmonary rehab, is to wrapping your head around that physiology, to understanding your process, to understanding the possibilities and the things that could happen with that air trapping, to understand the dynamics of it. And once you put yourself in that, picturing that situation, and then I would tell my patients, it's you, it's your lung. Feel it, understand it, pretend you're it, and visualize what you're trying to do. It certainly helps. Pulmonary rehab is extremely important for all of the facets that we've talked about. But again, it rolls right back to that part of where your major discomfort comes in pulmonary rehab, because everybody, we ask, why, what do you think, what do you want to get out of this? I want to breathe better. And that's the name of the game. So again, I know that we all know about pulmonary rehab. I know that you're familiar with it. I didn't want to just come in here and say, go exercise. If somebody told me to go do something, tell me why. Tell me what the benefits. Tell me how I'm getting something that specifically for me if I'm the one here doing it. So I wanted to give you some of that science-based things that you could take into while you're doing the exercise, while you're walking on the treadmill, and while you're learning about nutrition, which is very important too. Again, I could talk probably for hours, but I don't have that time. I don't want to get in the... All right. But I wanted to... Yeah, absolutely. I like I said, you come here to be educated. I want to give you something when you walk out the door and say, I'm smarter right now when I walk out than I was when I walked in. And hopefully we've managed to do that. Thank you. Does anyone have any questions for me? Yes. Okay, and the question was that not so much from the obstructive side, but from the restrictive side. And so, yes, absolutely, that is a different side of the coin. But pulmonary rehab, when you go, have you been to pulmonary rehab? Okay. They didn't? Okay, and see, that happens a lot. And so what I would say is that address that. When you come into a facility, and I would come in with a patient, when a patient shows me or tells me that they are owning their process and they understand what they're here for and what they're looking to get, then you step right up and say, okay, sure, you're obviously educated about this. So yes, there are specific things that we can do and would do a little bit different, because that's more of a not getting enough volume in because of not being able to stretch out. But we can certainly talk about that afterward. I can show you some specific things too. But go in and say, hey, you're educated, you know why you're here, you know what your process is, and here's what I would like to get out of this rehab. And believe me, the medical professionals there will respect the fact that you know all that. Good question. Anyone else? Yes, in the back. The question was that when you're at pulmonary rehab, you feel as though your lungs are getting stronger? But your muscles, the other major muscle groups, don't feel like they're keeping up to that pace, or you get tired? Well, yes, you can exercise your lungs. And have you been through a pulmonary rehab program at all? Okay, did they give you any valves, any flow valves, or different little handheld gadgets that you can use? No? Don't like those? You don't like that? You know what I use? I use harmonicas, because harmonicas are a lot more fun, right? I actually learned how to play it a little bit. Did you get those too? And so the answer to the question is yes, you can do certain maneuvers which will help to aid in your lungs performing better. Is there one specific exercise that we go in there and say, hey, this is going to strengthen up your lungs, because they're not really muscular like that? But there are things, what we were trying to do is control the flows. It all becomes a flow matter, and controlling the flow in and the flow out and facilitating enough on both sides is going to get them to work better in the relationship that I described as far as the inspiration and expiration. And so the other muscle groups, if we strengthen those, they're certainly going to help with all that thorax stuff that I said, because that's what those muscles do. So if I strengthen the muscles that aid in the inspiration, if I can control flow better, I'm going to be able to mimic a normal response of ventilation, inspiration, expiration, to the best that we can. Your body is very sensitive. Your body wants to be able to use a certain amount of work to breathe and a certain amount of recoil, passive recoil, to exhale. When we have a disease process that interferes with either of that, we really throw off the system. And one system with your body, is the beauty of it is that one other system, when another system falters, another system will try to help out the best it can. But it's like anything else. It's like I always tell my students, it's kind of like the back of your watch. If, I don't know, nowadays nothing's like that, but you open up the back of a watch when I was a kid, and there's a whole lot of cogs and spindles and springs, and you're like, wow, how can those things work together to tell the time or to sweep those hands? Well, if I go in and I put my finger on one of those little tiny cogs, what am I going to do to the whole watch? Yeah, I mess up the whole system, and your body is very sensitive like that. So if we can understand that, put it in our mind what we're trying to do, and then be taught and instructed how to control some flow, how to develop some more musculature on this side of the equation to help the other side, that's where the magic comes in. There's not one specific thing that we're going to really be able to fix, but we certainly can help the components. Well, the earthquake one is because I'm scared to death. Yeah. You know, a lot of times when those things happens, one, you're moving typically more quickly than you would. Two, if you get afraid like that, you again tend to interrupt the nice normal process of what's happening. And if you're already at a level that's debilitated beyond normal, it doesn't take a whole lot, even thoughts, right? Anxiety can cause you to have that kind of reaction, because even your thoughts, like the earthquake, your body responds in a guttural way, and things are going to change. When you're nervous or something or scared, it's a whole different system that kicks in. So it goes away from our normal, hey, everything's fine, no earthquakes, my dog's in the house, I still got my keys in my pocket, which, by the way, I forgot my keys today, too. I rode in, and so I felt that, too. But it is a different system that kicks in, and that's why. And again, if you're starting already from a position that isn't what our body loves to be, and that's homeostasis, nice and normal, everything's good, then you're already at a disadvantage. And so, again, without going into huge detail, but that is why. Anything that causes that anxiety or fear or quick is going to be a different system that's driving us. All right, thank you.